Hello world, my name is Kundlas and I'm a primary care physician. I visited India last week to coordinate care of my father and my uncle. It was incredible journey to know that how chronic disease burden plays so much on family dynamics and how much planning is needed care for elderly at home. I have done my best job over the period of years to explain my father. Yes, he was prepared, but I felt that he was not very clear about what will it entail to maintain him at home and continue to have quality life. I have made a video in the past regarding 5 M's of geriatrics care or elderly care, where it is a standardized model which has been accepted in Canada and the United States to kind of gauge the complexity of disease burden and also direct healthcare services and providers regarding where they should focus and what things should be emphasized regarding ongoing care. Those 5 M's are your mind, what matters to you, medication, mobility, and multi complexity of disease burden. I decided that I will make a series of 5 in order to elaborate on this very important topic in geriatrics and senior care so that we all can benefit. And in this process of creating video, I think it has helped me to enlighten me more so that I could make a better decision and be a better physician. Today, in this video, you will learn about what matters and advanced directives. It is a very ambiguous and very difficult topic for multiple reasons. I think every human being has a right to understand what they value the most and how they want to be cared and what decisions they want to be made, both morally and ethically and legally. It has been tested that patients' choice or their autonomy understand the information, process the information, and whatever choices they make is the basis of healthcare system. So basic fundamental principle of patient autonomy supersedes most of the time so long as we could ensure the patient has understood the information and they have been able to process it properly and they understand rational choices, then they are allowed to make a decision no matter how much they conflict with family dynamics or physicians or healthcare providers' biases. Based on this principle, I think everybody should understand that they have a right to choose how they want their health care to be delivered and what kind of choices they want to make at the end of life. When we talk about what matters to someone is trying to understand their dynamics and to help them continually updating and changing their views based on what needs to be done. Most of us live unconscious life where we do not contemplate, and as a healthcare system, we do not provide information proactively to our seniors to engage them in discussion regarding what it will take to navigate the last leg of their journey in this world. There are multiple reasons. One is the time. Second, it's very difficult to approach the topic of end of life. And then there are cultural and social biases. But as a physician, especially after going through with my own family members, I've realized this is one of the first mistake a healthcare provider could do, that they do not talk to their patients regarding what matters to them and not providing them their options and not listening to them what they would like to do and how they want us to proceed and what choices they will make. And above all, how would they understand this information and out of their family whom they wish to make the decisions if they cannot make the decisions for themselves. In this video, we will be discussing about this important topic of advanced directives. Advanced directives purpose is provide directives or guidelines to help family members, healthcare providers, and other healthcare agents about your wishes. How would you like to make a choices, and what treatment you will accept and what treatment you will not accept. Second, you will also provide guidance to your healthcare providers regarding end of life. Basically, we could look at advanced directive through the lens of ongoing medical treatment and also end of life care. Let's first start with ongoing medical care. So long as a patient is fully alert and oriented and they could understand the information, he or she is the only one entitled to make their decisions. Unless patient decide to defer those decisions to somebody else, which they have to duly appoint to make the decisions on their behalf. So the first part is when you are designating somebody to make decisions on your behalf, we call it durable power of attorney slash healthcare surrogate, where you pick up somebody who knows you and is surrogating to replace you in the event that you are incapacitated and you cannot make the decision for yourself. That person will make the decision in context of your thinking process, and they will execute your wishes, not their biases, not what they want to do for themselves, not what they want to be done by others. They should be surrogating your wishes. So everyone should appoint healthcare surrogate or should have durable power of attorney, and they must talk to that person clearly that what they want, their wishes to be, what you want to do, what you do not want to be done. Remember, so long as you are fully alert and oriented and can understand different aspects of your treatment, you are in charge. If you appoint somebody that does not automatically step into your shoes, they will come into play only when you are incapacitated, and there are very stringent requirements when you will be declared incapacitated by your physicians. Physicians do not make this decision lightly because they care about you and they will ensure your rights are duly protected. Second part of healthcare delivery system is, just imagine that you have appointed a healthcare surrogate or you have durable power of attorney. They both mean the same, but you still want to guide that person to make decision according to your wishes. You could predefine multiple aspects of your treatment regarding what you want to be done, what you do not want to be done. Most of these decisions come into play at the end of life. For example, you may have very strong notion that you do not want to be resuscitated in case of you have problem where your heart or lung stops, or you want to get everything done. You may have options. You want to have mechanical ventilation where they put a tube down your throat and help you breathe, or you want to accept certain kind of treatment regarding antibiotics or nutritional support through whether tube or peg tube, making a hole in your stomach and artificially feeding you. So this living will empowers you, your wishes to be followed by healthcare delivery system and by your healthcare provider and healthcare surrogate. Further, you are in charge of your body and mind, and these advanced care directives, both durable power of attorney and living well, empowers you to do that. Now let's discuss why a lot of people do not have healthcare. Now let us discuss why most of the people do not have advanced directives. Most of the time, as I mentioned in the earlier part of the video, it is a very difficult experience, both for the physicians, patients, and families. And there are multiple reasons for that. As a physicians, we are in a business of saving lives, and sometimes we develop certain biases where we feel uncomfortable dealing with end of life, and we tend not to have open and clear discussion. Further, sometimes the family dynamics are such, which I experienced recently with my uncle, where family members' emotional needs override patient understanding, patient desires, and they end up making decisions contrary to what they believe. Many times, certain cultural, racial, and socioeconomic issues come into play where the decisions are not made properly. I think it is not a good practice not to have healthcare surrogate and living well. We should all think of having advanced directives. I've been asked by my patients who should have advanced directives, and I truly believe everybody should have advanced directives. Young adults, even though they do not have chronic disease burden, but they are more prone to accidents and other risky behaviors where they can put themselves into difficult situations where advanced practice makes perfect sense. Middle-aged and elderly definitely have a lot of chronic disease burden. They should think how they want their kid to be delivered, and they should continue to insist to have advanced directives. Every medical practice is supposed to have copies of advanced directive forms, educational information, and there are many online websites which I will add to the description of this video, which will help you to able to download this information and see what you could do regarding getting advanced practice for yourself. Then there are individuals who are in high risk occupation. They should have their medical doctor create advanced directives for them. Further, there are common questions which have been asked regarding advanced directives. The most common question I've been asked, do I need an attorney to create advanced directives? In most of the states in the United States, you do not need. I've been asked this question that do I need an attorney to create advanced directives? And I have done very thorough literature search. We are not required to have an attorney. Only thing which you require is that you understand what advanced directive is and you fill in the appropriate forms which are usually provided to me. You have to fill in the proof. I have done thorough research and I have noted that you do not need to have attorney. You need to fill in proper forms and you need to have these forms witnessed by someone who's not your family member or possibly does not have any conflict with you. You should take those forms to your primary care and he will sign and then they become legal documents. Second question most commonly comes into play is, can I change my wishes? Absolutely, you could change your wishes every day and you're not locked in once you sign the form. You can change your wishes based on your needs, your social circumstances. Further, I've been asked what is the name of the orders when I reach the terminal age. There are two commonly terms which are used in practice are number one, medical order of life-sustaining treatment and physician order for life-sustaining treatment. They both mean the same, but in each state, these are used interchangeably, but certain states you may have to use medical order for life-sustaining treatment, and some states you may have to use physician order for life-sustaining treatment. But for both of them, it is mostly for the physicians when they write the orders. Basically, through this forms, physician will understand your wishes which you have delineated in your living will and other documents, and he will, after understanding, carry out your wishes and write order in the medical record to explain about understanding your wishes. He will write this in the medical records, and that how your wishes will be taken care of. Further, what have been the impediments, like why we are not having the medical doctors and the healthcare system to have advanced directives? It is estimated that in the United States, only less than 25% of the people have ever had a discussion about advanced directives. And it is unfortunate because if we do not have this difficult discussion, the patients end up having unnecessary care which they would not accept. or they do not want it to be done. Further, it's very expensive to have end of life care regarding ICU visits, your care coordination at home, and everything else which is needed regarding mechanical feeding, mechanical ventilation, legal cost. So it is, I think, prudent that everybody should discuss regarding advanced directives. Another question I've been asked, from where somebody could get more information about advanced directives and from where they can get the forms. As I mentioned before, pretty much every primary care office will provide you these forms. Your specialist may provide you these forms. All hospitals, nursing homes, home health companies, they all want to know your wishes and want to comply with your directives. I think advanced directive is your ticket to get proper care the way you want it, when you want it, and even when you cannot make your decisions, to guide your family and also healthcare providers regarding your wishes. If you have advanced directive, you will save a lot of pain and misery to your family members. It is very difficult for your loved ones to make decisions on your behalf without talking to you regarding what your choices are, how would you like to proceed. So I think it is prudent that you make your wishes known, have proper advanced directives, and pass through this circle of life with dignity and feel confident with advanced directives that your wishes will be carried out. Thank you very much.